Hello, everyone, and thank you for joining me today. My name is Luz Okendo, and I'm one of your parent training coordinators here with the Family Star program. In today's presentation, we will be talking about individual healthcare plans and emergency action plans in the IEP and 504. We hope that this information will be helpful for you and your family. I will begin my presentation by sharing my screen. If you have any questions about this presentation or about your child's specific healthcare plan or emergency action plan, please feel free to reach out to us, reach out to me, and I can help you navigate your child's plans. I'll help you understand them more and ensure that they are robust and meeting your child's needs by reviewing them with you. Our contact information will be at the end of this presentation. So again, please feel free to call us, email us. If you're not familiar with FND, we are a 501c3 nonprofit organization. And what that means is that we do not work for local, state, or federal agencies. We are funded by the U.S. Department of Health as well as the U.S. Department of Education. And what that means for families is all the services that we provide will always be free of charge. So I talked a little bit about that. I also want to mention that we are not doctors, lawyers, or mental health professionals. So the information that we provide are always vetted and researched. However, we're providing this information not only from those vetted resources, but also through our lived experience. For me, I have a 17-year-old that has complex medical needs, and she too has an IEP with a healthcare plan and emergency action plan. All right. So what we'll start with is talking about the IEP process. And so we know that students with disabilities receive appropriate education services. And so this is through their IEP process, and that includes the healthcare services as a result of 3 laws. So we have the IDEA, which would be the law that would provide a child with an IEP, and it supports children who qualify under at least one of the 13 IDEA, which stands for the Individuals with Disability Education Act categories. And the goal of this plan, this law, is to ensure that students are receiving an appropriate education, again, that educational benefit. Then we also have our 504, which provides equal access. It is federally funded. And then children who meet 504 definition of disability include those, again, who also qualify under IDEA. So again, your child qualifies for an IEP, they automatically receive those 504 benefits through that 504 law. And then we have the ADA, which required equal access regardless of funding, individuals who meet ADA definition of disability regardless of age. So again, we have these different laws that protect our children in the school system, whether they have an IEP or not. ADA is still required, and a 504, they would have to have those accommodations as well. So what is an individual healthcare plan? It's a non-binding written agreement, and it outlines the student's needs included in a plan for addressing those needs that is developed with collaboration from the school staff, the student's family, the student, and the student's healthcare providers. Students who are eligible for this plan may require administration or monitoring of medication, have a stable health condition, but that requires routine monitoring, and maybe they use a particular device that compensates for loss of maybe a specific bodily function. They may also require health procedures throughout their school day. So it clarifies important things on how specific medications should be administered, and then how the student's health status will be monitored, where this would be happening, and who will be providing that support. It should be provided for staff, training, and specifics on who will be providing that training. Individual healthcare plans require the involvement of the school nurse, professionals, and then it also follows outlined steps as prescribed by the specific protocol. So an effective individual healthcare plan will include student goals and outcomes with regards to health, preventing disease and injury, and supporting engagement in the school environment. Children who are able to support their healthcare needs in a school setting are included in this information. It's also important to note that there are no federal or state protection under this document, which means that there is no legal recourse if the school doesn't follow the plan as written. However, it is attached to a child's IEP, and if so, then it absolutely will be required to be followed, as an IEP is a legal binding document. An individual healthcare plan serves the needs of both the student and the school. So according to the U.S. Department of Special Education, it was created originally in response to healthcare needs of students that affect or have the potential to affect safe and optimal school attendance and academic performance. So the plan considers how to deal with what may happen with a student that's medically while the student is in school. It is designed to address medical issues, not the student's learning abilities. These documents are critical for a student's health, especially when the student has multiple daily interaction with the school and nurse. So there are several important reasons that individual healthcare plans and documents are needed for interventions, right? So it serves as a foundation to develop other school plans such as an IEP or 504. It also ensures coordinated care, and then it assists with effective communication. It also provides quantifiable data that can be used to measure success. So what goes into a good individual healthcare plan, and then what to avoid. So an individual healthcare plan, again, it contains information, guidelines, and standards that promote a student's health and educational goals, and it includes assessments, nurses' diagnosis, goals. The goal in the individual healthcare plan, just like an IEP, needs to be specific, measurable, achievable, relevant, and time-bounded. This should include both short and long-term goals. Intervention should be details of instructions and whether the student participates in the process, the expected outcomes, and then as well as evaluations. It supports protocols to avoid unnecessary risk, restriction, stigmas, and illness. Areas to consider when you develop an individual healthcare plan would be the baseline health status of the student, the members of the individual healthcare team, and this can include the school nurse, a private duty nurse, doctors, educational and developmental specialists, dietary staff, transportation staff, if that's needed, and then community emergency teams. Feeding needs, if that's the specific need of the student, the equipment needs, transportation needs, staffing, training of staffing to implement the individual healthcare plan, student self-care needs, special considerations such as field trips, events, and other related activities. So example of a healthcare related need that may require an individual healthcare plan. So asthma, diabetes, seizures, ADD, ADHD, serious allergies, medication needs, chronic conditions, physical disabilities, catheterization, toileting assistance, mental health, and then even celiac disease. So now we're going to address the emergency action plan, also called an emergency care plan or emergency healthcare plan. And this is different from the individual healthcare plan because this is one we're talking about what happens when there is a crisis. So when would you need one? When the health condition has the potential to progress into a medical emergency or crisis. An emergency action plan is a plan that gives specific steps for school professionals to take when the child has a medical emergency. This emergency plan is written for a child who is more likely to have a specific medical emergency and can be part of the individual healthcare plan, or it can be written separately. Specifically for my daughter, we do have it written separately because we want to be able to identify that plan if that need occurs. School nurses may determine what will, if that would be needed. And then they also work in consultation with your child's physician, pediatrician. In my daughter's case, she has a complex care coordinator team. And so that doctor from that team works along with us to create the orders so that we can support the school on creating these plans. So developing an emergency action plan, it should be comprehensive. It should include all the members of the team that will be managing the crisis. It should be coordinated. Everyone on the team should be informed, educated about the situation, and have a coordinated plan in the event of an emergency. It should all be communicated. All the details of this plan should be communicated and updated regularly. If a student has an IEP or a 504, you should make sure that the individual healthcare plan and the emergency action plan, they are attached documents that all necessary individuals have a copy. My daughter has a private nurse that also attends school with her, so that nurse always has those documents as well. Like any important document, the emergency care plan should include information on who is the document for and who will be handling the emergency, what emergency needs to be addressed, when and in what specific situation does it need to be addressed, why is it important to take care of those needs, and then where would those needs be taken care of, as well as who will be handling, who will those needs be handled. Right, situations where an emergency action plan may be needed. So a peanut allergy, asthma, epilepsy or other seizure disorders, insulin-dependent diabetes, and then mental illness crisis. All right, so here's an example of an emergency action plan. If you see on the top, it has the student's information and then the symptoms, and then it talks about the treatment. And then, of course, transportation is also, and then in the bottom, you see who it was written by, as well as a healthcare provider, should more information be needed, or who will be contacted. Here's another example. This one has the student's information again on top, contact information, and then it also has for all fire drills. This is a very specific one as well. It also has if life-threatening emergency occurs, who to call, and then for healthcare providers, it allows them to fill out any additional medication. And then again in the bottom, you see as well, this one also has a parent signature. So you see here, you will also have a chance to review this document to make sure that you agree with the document. And if there's anything additional that you may think that needs to be added, that is something that you can collaborate with your school team, as well as your child's medical professional, whether it's a doctor or a nurse practitioner, to ensure that the information is on there that's needed. All right. So again, like I mentioned before, we as the parents, we are a huge part of creating these documents. We want to be able to collaborate with our school team and then have that involvement. All right, and that brings us to the end of our presentation. I do want to mention the programs that FND serves. We have our PEN project, as well as our PSN project and our POPIN project, which are all parent training and information centers. Those programs provide families of children with IEPs from birth to 26, provide them with training and information on the IEP process, IDEA, as well as community resources and supports. And then the Family Star program, which I am presenting today with, we provide parents that have children with complex medical needs as well as mental health needs with those similar supports, again, supporting families throughout their child's education journey, as well as community resources and supports. Here on this slide, you can see our link to our website, as well as our social media, where we are on Facebook, Twitter, and Instagram. So you can find us on those different social media platforms. And then we also have the FND University, where we provide families with information on our website as well. All right, and again, like I mentioned earlier, if you need more specific support for your child's individually, please don't hesitate to call us. Our phone number is 727-523-1130. And you can also email us at fnd@fndusa.org. I hope you enjoyed this presentation, and I look forward to presenting for you again. I look forward to speaking with anyone who wishes to give us a call. We're here to help.